morning.
Good morning.
Hey, how are you?
I'm good. How are you?
Good. So today's visit is really all about what's happening at your OBGYN visit. And Chanel has so graciously decided she would share with you what we do. So basically what we do is you want to always make sure the patient's okay. We're living in a pandemic, so we make sure she's fine. They do answer questions before they come in, and we know that they're safe and they're not having any symptoms. We're now in our third trimester.
Yay.
I know, right? You may read where this is 27 weeks until you have a baby. You may see some people say 28 weeks, but you're in your third trimester. Most importantly, when I look to see what's going on, I look at Chanel's blood pressure. Why is that important? Is one, in your third trimester, you're more prone to develop pregnancy-induced hypertension. Her blood pressure is fine. We check your urine. Why do we check your urine? We're checking for protein. We're checking for infection. We're checking for glucose to make sure you haven't developed gestational diabetes. She's fine. So then we measure. And I know people always wonder, what is this tape measure for and why are we doing these heart tones? Well, the reason we're doing that is we do what's called a fundal height. We're measuring from the top of the uterus to the symphysis pubis, where these two bones come together, which will give me kind of a rough guesstimate that her baby's growing appropriately. We've been measuring throughout, so there should be a change upward in fundal height. All right, we'll get you the life flat.
Okay.
All right, so we're going to measure, and she's gracious enough to share her belly. And you know, pregnant women don't really like sharing that, but she has a really good, nice, smooth skin. Some women develop stretch marks, and really there's not a lot she can do to prevent that. So again, the top of her uterus, her fundus, here. And then we measure where, and we're not going to show you guys all the good, so you're going to have to look at this part where her uterus comes to her pubic bones. And she is measuring right about 31 centimeters. And she's not been a big mama in this whole pregnancy.
Oh, no.
Yeah, but her last baby was like this, so she was fine. Then we listen for heart tones. Heart tones should be about 110 to 160 in the uterus. And it's really several months before the baby will get, or several years really, before the baby gets a heart rate of 70 and 80, okay?
Okay.
Most of the time, at this point, the head is down here. And we do, it's called Leopold, we feel for the head. And then we feel where's the back, and so we go for that area, which is really the back. You hear that nice, good heartbeat? And we listen not only for the rate, which in this case is 140s. We also listen for a rhythm. You know, regular rate and rhythm, you heard that. And we want to make sure the baby doesn't have any cardiac arrhythmias, because, you know, that is possible. They typically grow out of it, but if they do, we send them out to a specialist. So we have gotten her measurement, which is changing. We have got the baby's heart rate, which was regular rate and rhythm. I've looked at her urine. I looked at her blood pressure. She's not swelling a lot, which swelling is very common in pregnancy because you've got this uterus compressing how the blood and the fluid gets back up the hill to your heart. But she's doing fabulous. She is a little bit over pregnancy, but
Very much so.
yes.
Very much so. Come on out. Well, not
Okay,
yet.
no,
Not yet.
Yes,
But
so we do not want your baby out. We don't want her being selfish with her body. She has to continue to share her body with her baby. So that's what your OB-GYN, that's what your OB visit is all about. Growth, heart tones, make sure mama's okay, not developing pregnancy-induced hypertension or preeclampsia. She's not swelling a lot. We check your urine again because pregnant women are more prone to UTIs. She has an excellent visit today. She gets an A+.
Yay!
All right. So that is your OB visit. Have a good day.